Hello, my name is Rosanna Breaux, and recently my colleagues and I published an article in the Journal of Child Psychology and Psychiatry entitled Prospective Impact of COVID-19 on Mental Health Functioning in Adolescents with and Without ADHD, the Protective Role of Emotion Regulation Abilities. Today, I'm going to walk you through our study and our findings. In this study, we utilized a sample of adolescents, approximately half of whom were comprehensively diagnosed with ADHD, who we had been originally following pre-COVID with 5 pre-COVID time points, with that last time point ending in February 2020, right before the onset of the COVID-19 pandemic in the United States. We fortunately had asked for consent for families who were interested in being contacted should we conduct a follow-up for that original longitudinal study. And so we're able to contact those families early in the onset of the pandemic, around April 2020, to see if they were interested in participating in our COVID-19 follow-up. And so this study was specifically looking at pre-COVID mental health at that last time point right before the onset of the COVID-19 pandemic, and with 2 COVID-19 time points. One conducted in spring 2020 during stay-at-home orders or when lockdown orders were in place, and one in summer 2020 after those lockdown orders had largely been lifted. And what we were looking at was both parent and adolescent report of adolescents' mental health functioning. Specifically, we looked at adolescent self-report of their internalizing symptoms, things like anxiety, depression, as well as sluggish cognitive tempo, and looked at parent report of the more externalizing symptoms, things like ADHD symptoms of hyperactivity and impulsivity, as well as inattention. And also looked at parent report of oppositionality and defiance. And what we found, not surprisingly, was that from pre-COVID to that spring 2020 stay-at-home order time point, we saw significant elevations in both internalizing and externalizing symptoms. In fact, there was an increase in every aspect of mental health functioning that we looked at besides hyperactivity, impulsivity from pre-COVID to spring 2020. Fortunately, however, we also found that those rates significantly decreased for all mental health functioning symptoms except for inattention from spring to summer 2020, meaning that even though we saw this initial increase on the onset of the pandemic during those stay-at-home orders, that there's at least some early preliminary evidence that perhaps these symptoms were only short-term elevations during lockdown that then improved once lockdown orders were lifted in summer. However, what this paper also adds is the focus on, are there certain aspects that we can intervene and target to try to help improve mental health functioning. And we looked specifically at emotion regulation abilities. Now, emotion regulation is a person's ability to manage and adapt their behavioral and emotional response to fit with the magnitude of the situation. And so all of us, of course, we're experiencing some anxiety, some sadness during the pandemic, but some people are better able to manage and deal with that, whereas others might have a harder time and really kind of get stuck in those negative thinking patterns or engage in problematic behaviors to try to cope with those negative emotions. And so that's what we were looking at, was whether pre-COVID emotion regulation abilities predicted mental health functioning during the pandemic. And what we found was that adolescents who had poorer pre-COVID emotion regulation abilities were at increased risk for both those internalizing anxiety, depression, sluggish cognitive tempo, as well as externalizing symptoms, hyperactivity, impulsivity, inattention, as well as oppositionality and defiance. And we also found what we would call additive risk between ADHD status and emotion regulation abilities, such that the adolescents with ADHD who also had poor pre-COVID emotion regulation abilities were at the greatest risk for the higher levels of externalizing symptoms. Again, this includes things like inattention, and hyperactivity/impulsivity. And so even among adolescents with ADHD, those who had poor emotion regulation pre-COVID were doing worse in terms of externalizing mental health functioning relative to adolescents with ADHD who had better emotion regulation abilities. And so what these findings really suggest is the importance of teaching coping and emotion regulation skills to adolescents to help them better cope in times of chronic stress like the COVID-19 pandemic. Fortunately, there's lots of brief interventions that are possible, including via telehealth, which is important during the ongoing pandemic, to help equip adolescents with these skills. It is important to note, however, that since these data were only collected kind of in the early stages of the pandemic, spring and summer 2020, it's important for us to continue looking to see changes in mental health functioning as the pandemic has gone on, and whether this early promising findings of improvements in summer 2020 was simply a result of school being out of session for these adolescents, the decreased rates in the country in terms of COVID infection during the summer relative to spring and fall 2020, or a mix of lots of factors. And so encouragingly, at least with this sample, we do have 2 additional COVID time points that we've now been able to collect in fall 2020, as well as one that we just finished collecting in spring of 2021. So we can look to see how mental health functioning has changed over the course of a year during the pandemic. Thank you so much for listening. And I just want to take a moment to thank my colleagues who are a part of this study, particularly Stephen Becker at Cincinnati Children's Hospital, as well as Melissa Dvorsky, who's at Children's National Hospital and George Washington University, and Josh Langberg, who's at Virginia Commonwealth University.